Amy to begin the presentation.
Great, thank you, Anita. Hi everybody, it's really a pleasure to be here, hosted by our HSC to do this webinar, and really appreciate all the interest that we got initially from our quick overview in Mexico. So as Anita mentioned, today I'll walk through the full framework, and then we'll have questions at the end to see if there are any points that you'd like to dig into further or raise. So I'll just start from the beginning. You should see the cover slide, Healthy Markets for Global Health, Market Shaping Primer first. And what I wanted to do is provide some context around what we're thinking about for the overall goal for market shaping. And so if you'll see from this next slide, the focus of all of these approaches is really reaching that end user and increasing uptake of really important health commodities like family planning products and making sure they're available and accessible to that end user. And so that's what we've tried to illustrate with these series of houses indicating that last mile and reaching that user. We also recognize that within the broader context, the end user lives within a marketplace of different actors who are crucial to making sure that those commodities are available. And so if we start from the right with the factory, symbolizing suppliers, we need to make sure that suppliers are able to manufacture the products, that procurers or donors have the funding available to purchase them, that the local ministries of health and other government bodies in country are able to register those products, regulate them, and ensure that they're incorporated into essential medicine lists and treatment guidelines and trainings, et cetera. The ambulance represents the supply chain and the distribution network that is required in country to make sure that those products don't just reach the border of the country, but really reach to that last mile and the end user. And then, of course, the providers who play an important role of informing potential end users both about a health condition, like the benefits of family planning, as well as the options for commodities that they can use to reach that health need. So all of these actors work together to make sure that that end user has access to health products. But they don't just work in a nice linear fashion. They also interact with each other, and there's a lot of different activities that take place in this marketplace. And so the suppliers speak directly to the country regulators. The distribution network also relies on capacity building and other information and technical assistance from donors and procurers. The providers similarly need the latest up-to-date information and medical detailing from the suppliers, et cetera. And so what you actually have in reality is a messy web of interactions that hopefully provide efficient access to products for the end users, but may not always. And anytime there's a break in these interactions, which could be one or more, represented by this red arrow, then you may have an inefficient market that's producing suboptimal health outcomes. And that's what we're really trying to focus on with this market shaping approach. It's looking at how do we strengthen the marketplace, the interactions between these important groups, so that we can increase access to health products for that end user. So on the next slide here, you'll see that all of those interactions we've represented with this scribble. And what we're trying to do is not reflect every single complexity of every market, but instead provide a flexible structure or framework that can allow us to identify the core problem and then hopefully reach an appropriate solution. And when we talk about market shaping, we're really looking at how we can use the purchasing power, the financing, the influence, or the access to technical expertise of countries, donors, and procurers in order to address those root causes that we're seeing in the marketplace. The audience for this is really global health decision makers and technical health experts like yourselves and others in different health sectors who are looking at whether or not market shaping applies to the specific product markets that they're concerned with. And so these health experts can sit in donor agencies like USAID, like the government of Norway or DFID, who've all provided input on this primer. They could sit in implementing or advisory organizations. And so similarly, groups like the Clinton Health Access Initiative and the William Davidson Institute and Results for Development all provided valuable input on this framework. National government offices, which could be the Ministry of Health or Finance or other bodies as well. And the supply side, really looking at manufacturers, distributors, and other supply side actors. And as you'll notice as I talk through this, this framework, and as we've designed this primer and tried to incorporate input from a number of different places, we've looked at more than one health sector. So the framework that we present here is deliberately designed to be flexible so that it can adapt to the malaria sector, the HIV sector, the vaccines, family planning, et cetera, and it really draws from those collective experiences as well. We saw a value for, especially a nascent field like this one, to really build on the collective experience across health fields rather than limiting ourselves to just one area. So the examples will be drawn from multiple health sectors. So what is the framework? The framework is this market-shaping pathway consisting of 5 steps, and they're listed here. 1, observe the market shortcomings. So identify what you see as potential problems that are happening in the marketplace. Where are those red arrows appearing? 2nd, diagnose the root causes. So we don't want to stay at that surface level of what problems do we see initially, but really trying to understand what is the source of those problems. And sometimes multiple shortcomings that seem unrelated may stem from the same root cause. So we want to be able to have the data and the analytics to identify those. 3rd, after we understand the root causes, assess our market shaping options. So make sure that we are considering the full range of different possibilities that we could take with market shaping. 4th, implement it in a customized way, and we have some guiding principles that draw on those collective experiences about how to best implement. And then finally, but very importantly, measure the results. We know that markets are constantly changing, so it's important to see what is resulting from any intervention and how the dynamics of that marketplace may have shifted, and we may need to adapt the intervention. So I'll speak to each of these 5 steps in a little bit more detail. In the primer, we've also listed for each of these 5 steps important questions to consider. I'll move through this quickly right now, but there's more description on each of these in the primer itself. So we start with observing the shortcomings. We symbolize them here with these puzzle pieces that are tied together with a ribbon to indicate that they really are intended to be considered as a set and not as a single characteristic of the marketplace in isolation. So these characteristics, shorthand 5 A's, we've listed as affordability, availability, assured quality, appropriate design, and awareness. And the reason I emphasize that point that these are intended to be a set is because we wouldn't want to look at a marketplace, for example, for affordability, and just think about how do we lower the price point and possibly at the expense of availability. So for example, we could see a market that pushes for the absolute lowest price point today, but then that price point is not sustainable for multiple suppliers, and it drives those suppliers out of the marketplace, and we have less availability of that important product in the future. So we want to make sure that by combining these characteristics, by looking at them holistically, we're really ensuring sustainability of the global health marketplace that we're looking at as well. So it's useful to think of these 5 A's, or these different aspects of market characteristics, but what we're really concerned with in this step is what can go wrong. And that's where we look at these potential market shortcomings. We've listed a few in orange here. They're not the full range, but they give you a sense of what could be a problem along each of these types of characteristics. So some of them are fairly clear. The price could be too high, in availability, the shortage, there could be a shortage or not enough. But the volatility within a characteristic can also be a problem. So for example, in availability, one year you might have too much supply, and the next year you might have too little. And this cycle of moving between shortages and excesses can be a problem as much as just having too little or too much in any single year. Another shortcoming that I'll point out that may not be as obvious is looking at appropriate design. And here, we're really interested in making sure that we have enough product options within a category so we can provide the end user appropriate choice, which of course is a very important value in family planning. But we also want to make sure we don't have so many options that the supply is splintered between too many suppliers or too many different variants. And what the potential consequence of that is, is that no supplier is then motivated or has enough commercial incentive to supply that type of product. So we want to make sure that the product designs are adapted well for the end user and that there's enough choice, but not so many that the demand is overly fragmented. And one other example I'll bring out is on the awareness side. So a lot of the market shaping interventions to date have been really focused on supply side. But we want to emphasize here that we recognize the supply side cannot exist without appropriate demand. We need to make sure that the awareness of the health condition and the health product is present so that the end users, their influencers, and the providers who may be required to administer those products are all appropriately informed about these products, and that they diagnose the condition appropriately and prescribe or administer them appropriately without having overuse. And in the case of antibiotics, this can really be a challenge because we need to make sure that resistance doesn't develop and those antibiotics can remain effective. So those are the different types of market shortcomings that we could see in a marketplace. Well, what could the root causes look like? And here we've grouped them into 3 categories. The first is reduced transaction costs. The second is increased market information. And the third is balanced supplier and buyer risks. So for transaction costs, this is really lowering the structural hurdles and encouraging more supply-side actors to enter that marketplace. The second of increasing market information, it could be generating absolutely new data and bringing that to light, or it could be improving the visibility of existing data and making that accessible for those actors in the marketplace who could use it for their planning and to engage more actively. And the third of balancing supplier and buyer risks is really looking at transferring financial risks, typically from the donor or purchasers or the buy side, from the supply side to the buy side to encourage engagement from suppliers. And this could encourage existing suppliers to act more in the marketplace, or it could even invite new suppliers to enter who otherwise would not have. So as we think about these 3 categories of potential root causes and what we can do to address them, that brings us to step 3, really assessing our market shaping options. And that's symbolized here with these checklists to say, well, if we know the root cause or causes, because there could be multiple of them, which interventions are appropriately designed to match up and tackle that root cause. And we've listed a few in the primer. Again, this is not intended to be comprehensive, but it is intended to be to present a range that can be a starting point for brainstorming on what interventions we could use in market shaping in a specific market. So if we take that first category of reduce the transaction costs, so make it easier for actors, especially supply-side private sector actors, to enter and act in the marketplace. I've listed on the right side different types of interventions that fall into that grouping. Pooled procurement, coordinated ordering, variant optimization, simplified or harmonized registration systems, or strengthening the quality assurance system. Now you'll notice that some of these will also help increase the availability of market information. And so there will be interventions that can address more than one root cause, which is great because in many product markets, more than one root cause may be at play. But they're primarily focused on reducing transaction costs. The second group, the second category of looking at a root cause by increasing market information, we've listed 4 here. There could be a market landscape analysis to provide more information, conduct or coordinate strategic demand forecasting, or provide more transparency of existing information. And that could be done on the pricing side, with pricing information exchange, or a quality assessment. And you'll notice again, some of these also reduce or balance risks between the suppliers and the buyers, as well as increasing market information. And then in the third category of balancing risks, we look at a range of different types of interventions here as well. Advanced market commitment, volume guarantee, promotion incentives, channel subsidy, essential medicines list and guidelines inclusion, prizes, and product development partnerships. So for all of these interventions, we look at, in the primer, how they operate, what root causes they can tackle, as well as the benefits, the drawbacks, and the implementation constraints in order to use them, as well as examples from across the health field. So if any of these strike you as interesting and potentially helpful for the products that you're looking at, there is more information and more detail in the primer about these. There are also a few examples of these in the family planning space that I wanted to highlight. So when we think about reducing transaction costs and coordinating the ordering process, think Access RH, which provides a catalog of negotiated prices for quality assured products, is a nice example of how that can already make it easier for potential buyers and suppliers to engage in the marketplace. Similarly, for increasing market information, the landscape analysis and pricing information exchange are both incorporated into the system of RH interchange, and that really brings more information about the family planning space to light. And then thirdly, in this last category, obviously the volume guarantee probably jumps out at you as a very prominent market shaping intervention in the implant space that has been used. So once we have a sense of what our different options are, then we need to look at how to actually customize the implementation to a specific marketplace. And here we wanted to emphasize a few principles that we've seen work very well and be very valuable in the implementation of other interventions in the past. So the first is collaborate from the start. And this is really a common theme that we found, whether we were looking at the HIV sector, the family planning sector, or any other health sector, is that the marketplace is very interconnected, as we showed earlier with those green arrows. And so the more that you can collaborate, even from the first step of observing the shortcomings and the second step of diagnosing root causes, you'll have access to more data if you're able to engage the full set of key actors, and then it's easier to get buy-in as we move forward into the actual implementation and design stages. So we really wanted to emphasize that from the very beginning. 2 and 3 are sort of connected, looking at the trade-offs and watching for unintended consequences. As I mentioned before, we need to make sure that we do sufficient scenario planning and really sufficient analytics to make sure that in shaping the market, we're not inadvertently causing any other results to happen that are undesirable, or that we can mitigate those risks. The fourth one is to plan an exit, because some market shaping interventions can have a timeline to close. And so the purpose of these interventions is not to just intervene for a short period and then have the marketplace fall back to inefficient health outcomes after you leave. You really think about that sustainability from the very beginning. So for example, with a pricing information exchange, that might really help more actors to engage in the marketplace once it's implemented, but then we need to think through who will update that information and continue to maintain it so that it can continue to provide that value going forward. And the fifth principle is act soon and adapt. And this is really looking at the reality that as soon as an analysis is done, the market's probably already changed. So the faster that we can move and implement an intervention after that analysis, the more likely it will still be appropriate for those conditions. And to constantly monitor the results, which leads us to the fifth step, so that as we see, hopefully, these market characteristics being better connected and health outcomes being improved, that we make sure that we can measure what's happening and adapt if needed. So we can measure certainly what's happening on these 5 characteristics: affordability, availability, assured quality, appropriate design, and awareness, but also what's happening on the health outputs and health impact, which we're ultimately most concerned about. So all of those 5 steps combine to bring us together to this market-shaping pathway, which is summarized here. But as I mentioned, we need to understand how it actually works in practice, both in the past and as we look forward to potential applications. And so in the primer, we've used 4 case study spotlights to highlight different aspects of the market-shaping pathway. They are not intended to be fully capturing the story of what's happening in those marketplaces. Many other actors and activities are happening, but really just to spotlight what is relevant for those steps that we're pointing out in our market-shaping pathway. The first 2 steps, observe and diagnose. We look at the anti-malarial market of artemisinin combination therapies, ACTs, and look at the global forecasting challenges present in that market. For the third step of assessing our options, we look at the ORS and zinc market and its ability to combat pneumonia and diarrhea, and how market-shaping possibilities were customized to different country situations and even sub-country specifics based on the presence of private sector actors and activity. On the step of implementing customized interventions, we look at the launching of the advanced market commitment for the pneumococcal vaccine and how that was implemented. And for the last step, the measuring results, we look at the evolution of how pooled procurement of vaccines has taken into account a more holistic view of the marketplace, really incorporating more of those 5 A's characteristics that I spoke about at the beginning. So that brings us back to this web of relationships that we started with. There's all of these different interactivities, but we have to recognize that market shaping, without the key actors who are capable and strength of enough capacity to be able to function well in that marketplace itself, market shaping can't achieve its intended goals. And so it really rests on a foundation of functioning health systems and reliable other interventions, the ongoing global health programmatic interventions, in order for market shaping to work. And what we've provided here is a schematic or spectrum of looking at the different types of interventions that are done in global health along a rough value chain. And so you can see at each stage where the different types of interventions can fall. And it's more of a spectrum on the vertical axis, from the green and orange axis, of market-shaping interventions that move into global health programmatic interventions. It's not a clear divide that says, at this point, everything above here is considered market-shaping, everything below is global health programmatic. There are different shades of grades based on how these are implemented and designed. But you'll notice that on the lower axis, you see ongoing commodity procurement and healthcare provider training. These aspects of global health interventions are crucial to making sure that the foundation is present for a market-shaping intervention to work. If all of the commodities are affordable and available, accessible, et cetera, but you don't have enough providers to physically administer those products, it doesn't do that end user any good. And so we recognize that market shaping alone cannot solve all of these uptake challenges, and it really has to work in partnership with these other activities. So I've spoken a lot, and I'm going to wrap up here so take your questions. But I just wanted to sum up with a few of the takeaways. The 3 levers that market shaping can use to address shortcomings: reducing transaction costs, increasing market information, and balancing risks. Looking at how market shaping really draws on resources that countries, donors, and procurers have, which is their purchasing power, their financing, their influence, and their access to technical expertise. What I just pointed out, that market shaping does not operate in a vacuum, but really rests on a foundation of other ongoing programmatic interventions, and also that not every situation necessarily calls for market shaping, which is why that pathway, those 5 steps that I've talked to, are so important to make sure that we do consider all options and whether or not market shaping is really the appropriate intervention for a specific product market. Looking at markets holistically and really examining their characteristics along all aspects of those 5 A's. Thinking about these guiding principles, especially of collaboration, and looking out for trade-offs and unintended consequences from the start. And then finally, making sure we measure the effects as we go along and after an intervention is implemented, as far as we can, hopefully pushing towards health impact, because that is ultimately our end goal. And so how do we apply it to actual product markets? Well, I think in the family planning space, it's an exciting opportunity as we have the RHSC Market Development Approaches Working Group here, really looking at these opportunities in partnership with the FP 2020 Market Dynamics Working Group. In the reproductive, maternal, newborn, child, and health space, there's the UN Commission on Life-Saving Commodities and their working groups that are looking at market shaping at both global and local levels. And then in the malaria space, and the indoor residual sprays, as new generation products are being developed, there's partnerships that are being formed to similarly look at market shaping options. So this is just an initial look at how market shaping can help increase access to health products in different areas. But we're also very interested in hearing your thoughts on other product market opportunities that could use this approach. So I hope this provided a useful overview, and I look forward to your questions.
Hello, everyone. As we get ready for the question and answer session, I just wanted to give you a little bit of background on GoToWebinar. So thank you very much, Amy. That was a really excellent presentation, very clearly laid out. And what we have on GoToWebinar are 2 ways of asking a question. You can either type a question into the question section, and then we'll see it on our end, or you can raise your hand, and then we will unmute your line. So I will open the floor now to questions, and I'll give you a few minutes to type them in. In the meantime, Amy, while people are getting their questions together, perhaps we'll have one from the PATH office here in DC.
Yeah, thanks for a great presentation. So my name is Nick Litter. I'm with the Market Dynamics team here at PATH. A lot of times, there's a lot of terms that get thrown around, whether it's market shaping or market dynamics or total market approaches. What do you sort of see as the differences between these different terms, and if you could maybe talk a little bit about that?
Yeah, I'd be happy to. So I think market dynamics and market shaping are probably the most interrelated. And market dynamics is really looking at those green arrows of the interactions between those different organizations that all operate in the marketplace. And then market shaping is looking at the actual intervention that can hopefully streamline or increase the efficiency of how those interactions work. So I think those are the almost flip sides of the same coin, where the interactions of the dynamics and the actual intervention is the market shaping. And so the terms really just place different emphasis on what you're looking at. I think total market approach is closely linked, and it's an important process of thinking about different types of markets, especially in family planning. And it's really looking at how do we make sure that we've engaged all of the potential channels in the family planning market. So the for-profit commercial sector, the nonprofit private sector, as well as the public sector. And often what is least understood is the for-profit commercial sector, which is really what market shaping is focused more on. Is how do we engage those for-profit commercial suppliers who are already supplying, and how do we invite new ones in if we want to diversify the supply base. So I think they're closely linked. The total market approach also looks at other aspects of product delivery and introduction that may not be as much a focus of market shaping itself.
Thank you.
Thank you, Amy. I have a question, actually. Since we're working so closely between the MD working group of FP 2020 and the various working groups of the coalition, we've come across products in family planning where we might want to evaluate whether or not there's a market shaping opportunity. How can we apply this approach to family planning products?
So I think actually one step that we've already taken as a group or really looked at taking is starting with step one of assessing, observing the market shortcomings. And I think one effort that's in its initial stages, but I think can be very valuable, is creating a set of metrics that we can use to measure a specific family planning product market's shortcomings. So whether it's looking at affordability of those products, availability, assured quality, appropriate design, or awareness, we're able to start to understand what is happening in the global marketplace, and then hopefully fill it in with actual data for a specific product market. And once we have that actual data, then we can do the analysis to understand to diagnose those root causes and then see what type of intervention might be appropriate. And we also have to be open, of course, to the fact that market shaping may not be appropriate for every family planning product market. So it's great to specify upfront, here's how we're going to measure those 5 A's for family planning, actually fill in the data, and then diagnose what is happening. And if those root causes seem to stem into those 3 categories of this is a matter of transaction costs being too high, information on the marketplace being inadequate, or risks being out of balance, then maybe a market shaping intervention could be well suited. But if it turns out that it's a very different situation, perhaps it's just too expensive, the active pharmaceutical ingredient is just too expensive, or the manufacturing process is too complex, or there's just not enough community health workers or nurses who are being trained in order to staff appropriately, then maybe that'll move us more towards looking at other ongoing programmatic interventions that tend to happen on a more steady basis rather than a catalytic, usually time-bound intervention like market shaping.
Great. That was really helpful.
So we received a question from the audience using the question feature here on GoToWebinar. This is from Milka Dinev. How can we make sure a market shaping intervention is sustainable?
I think that really puts the responsibility on the practitioner of the market shaping intervention in the design phase. So as we think about the options in step 3 and moving into step 4 of actually implementing, we have to think about that sustainability from the very beginning. So part of that will be looking at all of those 5 A's of the market characteristics and making sure that any intervention appropriately addresses the shortcoming that we see but doesn't sacrifice the health of another market characteristic. And then as we think about the intervention itself and how it can be continually in operation, or at least the effects can be lasting, have to be incorporated into the design. So as I mentioned with the pricing information exchange, I think that can be really important, or the strategic demand forecasting. All of those data and analyses can be really important in informing market shaping and engaging all of those actors on a short-term basis. But if they don't have a way of continually being updated with the latest data and being shared on a current basis, then the benefits of that can fall away. So making sure we think up front, well, who will maintain this database? Who will continue to update that data and make sure that the different suppliers or other actors are able to access it? We need to plan for that in the beginning. And sometimes it may require funding or the setup of a secretariat or some kind of third party who can continue to own and have responsibility for making sure that that intervention continues, or at least its benefits continue. In some cases, it doesn't necessarily require financial investment. So if a pooled procurement practice can more effectively bring new suppliers into the market and keep them interested and engaging, then that could just be a standard practice that is then rolled out on a continual basis. So for vaccines, we're seeing a pooled procurement that can maintain a healthy marketplace on an ongoing basis that doesn't necessarily require constant investment. So it can be a change of practice that's designed from the very beginning, or it may require an upfront investment, or it could be a third-party secretariat or some other body who understands that if everything works out as expected, they would be able to take it forward.
Great. And we have a hand from the audience from Manuska Rai. So we've just unmuted your line, Manuska.
Okay. Hi, Anita. Hi, Amy. Just a question. I was looking at the UNITAID Market Dynamics dashboard, and in that, they look at the severity of the market shortcomings and actually tell you which intervention is most likely to have a high impact. Like, so they get kind of rated high, medium, and low. Is there do you have something similar to that in your primer?
Well, I think what we've tried to do is, and we've certainly looked at the UNITAID dashboard, which I think is a really helpful framework, and we've looked at others, the UNICEF and others as well. And what we've tried to build is a framework that is really flexible to a lot of different health situations. So I know UNITAID focuses on HIV, TB, and malaria, but we've also tried to have the flexibility to incorporate products like family planning and others. So we don't necessarily have a matching of severity of shortcomings to the intervention, but instead we've really focused on how do we match those 3 root causes to a potential list of interventions as a starting point, but really put the onus back on a practitioner who knows that product market the best to understand what are the specificities of what you see in the marketplace, who's operational, who are the suppliers, how are the power dynamics that are present there, and then you as a practitioner and as an analyst would then need to do that matching yourself to make it specific for that market, make it tailored to your situation. So we don't have a menu that nicely matches that up for every situation, but we hopefully provide frameworks and suggest analysis and data to look at that can guide you in making that decision.
Okay, thanks.
Thanks for the question.
So we have another question from Chris Brady here that was typed in. He says, excellent presentation. Under the observed step, awareness was described as touching on demand creation. Does this include the existence or non-existence of traditional product marketing activities?
I think the awareness, as we look at what's happening in the marketplace, it would look at the existence or non-existence of traditional marketing. And so we see awareness is really low, whether it's among the providers or the end users or their key influencers. We would have to take that into account as we think about what are the shortcomings at play and how might that relate to a root cause. So when we looked at the ORS and zinc market, we saw that there was a strong preference among caregivers to continue using less effective and more expensive antibiotics in some situations. And so that would be a market shortcoming that we would need to understand as we go forward and think about what types of market shaping or non-market shaping activities we could undertake in order to increase the level of information among potential caregivers of the benefits of ORS and zinc, when to use it and how to use it, and the value of that over antibiotics. So I think we have to take into account what is already happening, whether it's marketing or other ways of moving information into the people, to the audience that needs them the most, or the lack of it, and then really pointing us to ideas like social marketing or other pieces that can address that shortcoming and root cause.
So we have another question from Martha Brady, and I'm unmuting her line right now. So Martha, go ahead.
Oh, sorry, Martha. We're unable to hear you. Perhaps you're still muted on your end. Okay, we'll come back to you in a minute. We'll go on to the next question.
Yes, we have a question from Audrey Sullivan. Could you elaborate on strategic demand forecasting?
Sure. The strategic demand forecasting that we were referencing is really looking at how do we provide more information and predictability into the marketplace when there's a lot of uncertainty around what we could expect uptake of a new product or either at the country level or at the end user level. And so the strategic demand forecasting can play different roles. One, it can generate new information, perhaps by aggregating uptake information across many different countries and presenting that to suppliers so they have a more holistic view of the marketplace, and that might be difficult for them on an individual basis to collect. It can also take a different format where there might be multiple demand forecasts present, but then that might present a confusion around which has the best information, and they may be using different sources of data. So when we looked at the spotlight on the ACT market and anti-malarials, there was really a push to consolidate the efforts of 3 different demand forecasts and the data they were drawing on so that they could present a consolidated view and the most informed view of where that ACT marketplace was moving and how much demand they could expect so that suppliers could then plan and respond accordingly. Does that answer your question? Or it was typed in. I hope that answers your question. Feel free to chime in more if it doesn't.
Sure, Martha, we're going to try you again. Were you able to reconnect?
I'm here. Can you hear me?
Yes, we can hear you now.
Oh, good. Okay, great. Thanks, Amy. That was very good and very well laid out, so thank you for that. And I'm familiar with some of this work that you've been doing, so good for that. I have just a quick question/comment. One of the things about this whole area, and you've alluded to it in some of your examples, which are all the examples you've mentioned are basically not from the field of reproductive health and contraception. And so I think it would be really useful, and maybe you have these, but I would argue that contraceptive and family planning is a very different beast. So while the process makes sense, I think that makes total sense, but I would like to see if we have actual real examples specifically from contraception, because I think it's actually a very different kind of whole market, and it's about sex and power, which the other products are not, and are in many ways easier. So anyway, my point is, I guess, just to sort of see what analysis have you done with particularly contraceptive products, and which ones specifically?
So I'll answer that according to some of the examples that we've mentioned, but then I'll also turn it over to Anita because I know RHSC and Dahlberg have produced a report that focuses just on the family planning market. But a few of the examples that we've mentioned in the primer that relate to contraception and family planning are the Access RH catalog, and that really speaks to the value of coordinated ordering that can help reduce transaction costs in a marketplace. So in the Access RH catalog, as you probably well know, but I'll mention it here to bring out the points that are relevant for this intervention, the prices are already negotiated by UNFPA. It is a list of quality assured products, and it gives information on orders via the RH interchange. And so it provides information and it helps new buyers enter the marketplace and reduces the transaction cost of engaging. The RH interchange itself, also by sharing the data on orders and volumes, can help increase the level of market information and inform potential suppliers or existing suppliers on how they want to plan their own capacity. And then the last that I'll quickly mention, although I'm sure Anita will touch upon as well, is the implant's volume guarantee and its ability to cut the price in half. And so I think there's been a lot of discussion and analysis around the impact of that volume guarantee as well. I'll turn it over to Anita.
No, just one point. Yes, I'm familiar with the implant volume guarantee business, and that. But one thing, and one of your colleagues, Amy, in the Global Innovation Fund that I had a meeting with earlier this year, was also kind of suggesting that we can't just rely on these volume guarantees, that that's sort of a very particular thing. So while it's one intervention, that may not be an intervention that's going to be replicable with other products. that's one thing. And the other thing is, I think that while I'm very supportive of the, and I think it's been great to cut the price of the implants, it will be important, I think, to follow that, to see, in fact, what if you have a push out then of product and how that actually translates in the field in terms of, is there real practical capacity for pushing out these large volumes and uptake and removals and all of that. So I think it's something that we have to be interested in both ends of that question.
Oh, absolutely. And actually, Martha, I have to say, I think you're making a case for my framework because I think that's exactly the reason why we really are supporting this structured analytical approach to thinking about market shaping. That I don't think a volume guarantee is going to be replicable for every single product market.
I'm sure
we really need to do the data and analysis to make sure that when we use it, it's appropriate. And in terms of the capacity in the field and other pieces, we need to monitor and measure the results of an intervention very carefully to make sure that the uptake is able to be sustained in the field, that removals are also planned for, that all of that service delivery cost is also accounted for. So I think all of that speaks to the importance of measuring the results and possibly looking at needs.
Yeah, and yes, no, exactly. And is that happening is my question, though. Sort of, I understand all the framework, and we need to pay attention to X, Y, and Z, but I'm curious about, is those X, Y, and Zs actually being looked at? Maybe it is. I don't know. But
well, Martha, I think you make a lot of excellent points, and I think one thing we talked about when, as a global health practitioners, we met about market shaping was that there's not a framework yet for properly doing M&E for market shaping interventions in global health, and that it's an area that we need to build out more and to understand both the short and long-term impact of these interventions. How should we measure success? And so I think there's still a lot of work to be done to do that. And so while we have a theoretical framework now, how it could be evaluated in reality is still unknown.
Yeah, I think it's, yeah. Yeah, and I think it's just really, I'll just iterate, reinstate that I think it's actually extremely important to now see how that pans out in reality, and sort of the monitoring of that would be really key. So hopefully someone will be doing that. I mean, I do know, and I'll just, in self-disclosure, I worked on the first contraceptive implant, so I'm very familiar with implants, and I have yet to see still in all the stuff that's going on, when I ask people what is their strategy for removals of implants, not getting a lot of response back to that. So I hope that that's being paid attention to. It's about quality of care. So I'll be quiet.
Oh, no, thank you for your comments. We really appreciate it. And just going back to a previous question that you had about what's happening right now for market shaping and family planning, I just wanted to call attention to the audience to the report that we did in 2013 called, the coalition put out, called Market Shaping for Family Planning. And in there you'll find a couple of other examples, including the Quorum Project, which looked at the need to bring more competitive quality assured suppliers into the market, and the types of efforts that they took, which are very different from the minimum volume guarantees. And then also the Pledge Guarantee for Health, which is a different mechanism for taking market shaping interventions. And I will pass this over to Jamie. Do we have another question?
Yes, so we had a question sent in from Sophia Assan at JSI. The diagnosis of root causes stage is also important, she remarks. Sometimes you can see multiple root causes, some of which reside in particular organizations within the value chain and not in the market dynamics. Can you talk a little more about the diagnosis of root causes?
Sure, and I completely agree that not all of the root causes will necessarily lie in the interactions with the market actors or the market dynamics side. And so then, speaking to earlier points, then market shaping may not be as appropriate. But there can definitely be multiple root causes as well. And so one thing that we've included in our primer is an appendix that lists potential analytical tools that you could use based on whatever shortcomings that you're seeing in your product marketplace. So it lists different types of market shortcomings, whether they're unaffordable prices, few suppliers, high dispersion in prices paid by countries with similar income level. So maybe one country is paying far more than their a neighbor of a similar income level, swings in prices, lack of adoption, et cetera. And as it goes through these different shortcomings, it has examples of analytical tools that you may want to examine. and the kind of data or detail points that those analyses would incorporate. So I won't list all of them now, but they are just listed as a guide to point you in a direction that can be helpful in thinking about specific shortcomings. And we certainly recognize that there may be more than one root cause at play, and it may not necessarily reside in the market dynamics itself.
Great, and we also had a question earlier from Milka Dinev, but just to let everyone know, we have about 10 minutes, so if you have any other final questions, please type them in or raise your hand so we can get those in before the end. But Milka asks, do all market shaping interventions have to be led by the government?
I don't think that all of them have to be led by the government. I think they should certainly take into account the views and the motivations and the perspective of a country government where an intervention would take place, because they obviously have a very informed view of what's happening on the ground, and they're a huge player in any kind of product marketplace. In fact, I think at the global level, some interventions can be shaped by different procurement or donor organizations, and then working in concert with government. I think there are also different ways of looking at market shaping, and some distinguish this between global market shaping and local market shaping. And so some of the local market shaping efforts, which tend to be more on a country level and may look at pieces like local manufacturing and supporting a supply base that is based in that country or regionally, that would probably engage a country government much more actively. But even at the global level, I think it should probably be, an intervention would be best informed if it takes into account the views of important country governments that would be affected by that intervention, to make sure that we are accounting for how it will look in practice and how it can actually roll out in the field, and we're not missing any local details that would be important as we think about implementation.
Great. I think we'll maybe unmute everyone for a minute, and if anybody had a question or a response to what Amy's talked about, or if you typed the question in and want to respond, please let us know. Okay, it looks like we don't have any more questions from the audience, so I think we will wrap up this webinar. And Amy, do you have any last words before we go today?
Well, I just wanted to thank you for the opportunity to do this webinar. I do hope that the participants here found it helpful, and really the value of this market shaping primer and the frameworks that are described inside are really intended to be a tool that you find useful as you think about the markets that you're working in and the products that you're looking at to provide increased access and usage of. So as you see opportunities to use this approach, we would welcome that input and suggestions, because we are really looking at how this can be made as practical as possible to reach more of those end users and hopefully increase usage of important family planning products.
Great. Thank you very much.
Thanks, everybody.